why did you choose to have an operation done as a treatment for your keratoconus?
Because I was diagnosed with keratoconus on December the 10th, and I was in the Netherlands, and they advised me to go to a cornea specialist, and I went to a cornea specialist, but it took about a month before I could go to my appointment. And I was like, what do I have? And I went on the internet and I looked up about all this stuff about keratoconus, and I found about cross-linking and about topo-guided cross-linking, that it can correct your cornea. So I was like, well, I want to get it fixed. I don't want to stop just my progression, but I want to see better with my eyes. So that's why I chose to go to Greece to get this done here.
Okay. And why did you select laser vision, .gr?
I chose for laser vision because if I read all the information on the internet, I found about Dr. Kanellopoulos, and everything you look at, like his Twitter account and like all the things like the topo guided images and stuff, and you see the progress, like it becoming like better, then I thought like, well, I'm going to go for this procedure. And I asked my corneologist in the Netherlands, like, should I get my cross-linking done for both my eyes in the Netherlands, or should I go to Greece to get it done at laser vision at Dr. Kanellopoulos? And he said, well, you might go to Greece to get like the topo-guided cross-linking, because it's a very new technique, but we don't practice it in the Netherlands because we don't have the equipment. So we do the normal cross-linking, but that just stops my progression, and I chose laser vision because, yeah, Dr. Kanellopoulos is like the person who kind of does this from the first time, so yeah.
Okay, and how was your consultation experience with Dr. Kanellopoulos?
It was pretty good, yes. It went really well, and he explained to me the thickness of my cornea, and he could pretty much answer every question I've got. And even though I keep coming up with new questions, he doesn't get like annoyed with it or anything, and like yeah, that's just great. And the consultation went fine, yeah, and yeah,
Thank you. What preoperative information did you receive?
Yeah, the preoperative information I got was from Dr. Kanellopoulos, and it was pretty excellent because I got most information that I wanted to know. Like, I got most of my questions answered, and yeah, sorry, I just, okay.
No, it's fine. Okay, let's skip the question, it's fine. How was your experience, and how long did the operation actually last?
The operation was pretty quick. Like, I was like still figuring out what was actually happening while I was in it. I was like, okay, so here's a laser, okay, and I have to look at a green light, and I looked at the green light, and that was like 2 minutes, and that was it. And then they swept me over to another table to get cross-linking done, and that took about 20 minutes. And then Dr. Kanellopoulos said like, okay, that was the hard part, the part that only lasted like 2 minutes, like the easy part. And I was like, okay, well, I found the cross-linking actually harder than, but it was pretty smooth and quick and not much pain. No, it was a little bit painful, but it was okay.
And this is my next question. Did you feel pain or discomfort during the operation?
Only a tiny bit, but it went away pretty quickly after they applied my eye drops, and then it was okay, yeah. Okay,
I'm happy with that. Were you pleased with the results?
So far, I can slowly see some improvement in my vision. But I know it takes about 3 months or even longer to stabilize and to improve my vision. So right now I'm just happy when I look at the topo-guided images to see the difference in the images. But the actual vision, like, I can't really tell just yet if it's improved. But looking at the images, that shows me something. So I'm happy with that so far. So.
Okay. And for the end, what would you tell someone considering Athens Protocol treatment for keratoconus?
I would tell them to go here and to definitely consider going here in case you have keratoconus and it's advanced, like in my eye, like I got stage 3, 4, and I can really see blurry with my bad eye, and I just hope I can see clear again eventually with my left eye. And my right eye, like I've got okay vision, so I would tell someone who has blurry vision to get this done, because if you get this done, you don't need to wear the contacts, hopefully, or the hard contact lenses, and you can go with soft contact lenses or possibly glasses. That's what I hope for, instead of having to wear a hard contact lens all day. And that's why I wanted to go for the Athens Protocol. Yeah. So.
Okay. And that's it, Walter. Thank you very, very much.
You're welcome. Okay.